So the next speaker is Dr. Mohal Banker, and he's an interventional radiologist practicing since 2001, and he is working as a consultant at Banker's Vascular Centre at Ahmedabad. Welcome, sir.
Thank you for nice introduction. Yeah. So today I'm going to talk about how I treat the vascular malformation. Paresh has already discussed lots of embolizing agents, permanent, temporary, and liquid. I'm going to discuss one embolizing agent which is least used and least discussed. So vascular malformation itself is a very confusing disease. If you think about the COVID, the corona into this COVID era, everybody knows about the treatment of the COVID. Even the पान का गल्ला वाला भी जानता था कि steroid कब देना है. But I have encountered in my practice कि in many senior vascular surgeon or plastic surgeon, they don't understand the disease. So confusion start with the names. Whether vascular malformation is named as a Park-Weber disease, Klippert-Trenaunay syndrome, but name, if you classify by the name, it will create a more and more confusion. So I have classified the vascular malformation according to the flow. Whether the patient coming with a slow flow vascular malformation or the high flow. It creates lots of clarity about the treatment, which I'm going to show you into the later part. Again, there's a confusion about the treatment, whether you go for the non-surgical treatment or the surgical treatments. In surgery, there is excision or reconstruction surgery, or in non-surgical treatment, there is a glue embolization or the sclerotherapy with some cetrol-like agents, or absolute ethanol embolization. So let me share you what is the treatment target. So you know about the vascular malformation has a nidus, and the nidus is a Latin word, it's like a bird's nest, and this nidus intima is very, very important because it has a mesodermal cell characteristic and it has a very highly growth potential. So if we want to treat the vascular malformation, we have to target this nidal cell. Now what happened? Most of this vascular malformation is embedded into the normal surrounding structure with the muscles and the bone, and that's why what happened, most of the time surgically it's very difficult to remove, because if you want to remove the entire lesion, you have to remove the entire muscles or bone, and then the normal structure, normal function can be jeopardized. So surgical excision is almost not possible in 80 to 90% cases, but still plastic surgeon and surgeon have done it. And second one is what many patients come with have a glue embolizations or some sclerosant agents. They have gone for the sclerotherapy. But what happened in this glue embolization or sclerotherapy? They block the lumen of this vascular malformation. But so what happened? The luminal, these nidal cells has the extra luminal blood supply. So temporarily there may be some size reduction of the vascular malformation, but the nidal cells are alive and they will actually they have the blocking the lumen is a hypoxia. It's developed the hypoxia, and hypoxia itself create the more new angiogenesis. So surgical excision, glue embolization, or the sclerotherapy, most of the time it fails into the long term. So what should we do? So we have to destroy the nidus, and for destroying the nidus, it is very important. We have to inject the 100% ethanol within the nidus. So we know the ethanol is different use, right? But 100% ethanol is very, very significant to destroy the nidus and for the permanent cure for the vascular malformation. So now we know the brahmastra, right, for treatment of the vascular malformation, but the absolute ethanol is a dual-edged sword. If we don't use it with the proper knowledge, it will create lots of local and systemic complication. So how to use it? Many of you know about these are the great world's investor Warren Buffett and Charlie Munger, and he has shown few principles for the investing purpose. But the same principle I have applied for using the absolute ethanol for the vascular malformation. So one of the most common mantra by the Charlie Munger, that is inward, always inward. So you don't think of what you want,
you think about what you want to avoid in inverting. So if I want to invert, if I want to reduce the complication of the ethanol for the treatment of vascular malfunction, so if I invert it, then I find that to avoid the complication of the ethanol, I have to take care of these three things. First, the dose, speed of injection, and the site of injection. Let me show you one by one. So another principle is stated by this Warren Buffett, that is a margin of safety. This margin of safety principle gives a clarity for the two things. One is the dose of ethanol and the rate of injection. So what Warren Buffett says that if you want to drive a truck on a bridge and you assume that the maximum load is going to pass from this bridge is 9,000 ton. So you cannot build a bridge of 10,000 ton. You have to build a bridge of 15,000 ton. There may be some variation. So there is a margin of safety. And for that, ethanol, all the journals and all the literature shows 1 ml per kg per session. That is also, you should divide it 0.1 ml per kg every 10 minutes of interval. And rate of injection is decided during the check angiography how much nidus is going to be empty. And according to that, you have to inject the ethanol. I personally inject less than 50% of the what describe the dose into this literature. I start with a 0.5 ml per kg per session. So again, the margin of safety principle, the site of injection is very, very important. Now, for the site of injections, it's very important to understand this Dr. 𝙂𝙬𝙗𝙪𝙡𝙀 classification. And he has described this vascular malfunction classification according to nidus. So he has described the four kind of nidus. So we have to identify the pattern of nidus and then inject this ethanol within the nidus cell. That is a very, very important thing for successful treatment. And most of the time, concerned and confused between the path versus target. That means feeding vessels versus the nidus. So if you inject the ethanol into the feeding vessels, it is not going to be helpful. You have to inject the ethanol within the nidus. So now there's lots of theoretical discussion. Let me show you some few cases. So this patient has a young boy and he has a vascular malfunction in the foot region. His father is also doctor, and MRI shows a very significant region of the foot is involved with the lesion, and there is a angiographic pattern of this nidus, large cavity, two-outward tract, and first we do this angiography and define the volume of this nidus, and then I inject the ethanol according to the flow rate and according to some body weight, and then also phenomena we have to take care of it. So now you can see over here, left hand side, there is a huge swelling, and the post procedure there is a significant swelling reduction, and the patient is very happy. Now his walk is also improved and no pain. So now there is a second case. You can see over here, there is a small boy and he has a vascular malfunction involving the lip, some facial muscle, also the tongue is involved, half tongue is also involved. And he comes regularly every monthly from Delhi to for treatment, and he has extensive malformation. And there is an angiographic picture, there is a nidal cell of the lip and the face region. Gradually, once we inject the ethanol, nidus is going to shrink, and so there is a pre-procedure picture. You can see there's lots of swelling over here, and now the swelling is significantly reduced. So now there is a case 3. This patient has a vascular malfunction involving these 2 fingers. Recurrent bleeding occurs at any time. Already 2 times operated by one time by a plastic surgeon, 1 time by a vascular surgeon, but problem is not solved. Came to me. These angiographic picture. There is a nidus, and I've injected this nidus. Now, important thing to understand is that once you inject the ethanol, there is always more pain, more swelling, and this will last for at least 3 to 4 weeks, and then gradually it will subside. If you see the picture, there is a second day picture. So you see there's a little bit more swelling, there's some blister develop, and you see the more blister. And after 3 weeks, patients, all these things are held out. And right now, if you see, the bleeding is stopped and patient swelling also reduced. So these are the good examples, but I want to show you my mistake also. These patients come with the vascular malformation and involvement of the hand and 2 fingers. Classical slow flow vascular malformation. I have started treatment of 𝙂𝙬𝙚𝙪𝙡𝙙𝙪 embolization. So first session, second session, third session, I was a little bit overconfident and I injected 𝙂𝙬𝙚𝙪𝙡𝙀 and it ended up with the amputation. So believe me, 𝙂𝙬𝙚𝙪𝙡𝙀 is very important and very good embolizing agent, but we have to use it very cautiously. And 𝙤𝙤𝙗𝙤𝙗 has already told us a few years back that if you don't have clarity in your mind, then remember that ethanol should be injected in such a way that you are not going to harm the normal tissue, and you are targeting the only nidal cell. So many times patients ask me, how many sitting is required, how much ethanol will you inject? All these are very direct questions, but while I start the treatment, I don't have an answer, because all these things are depending on how nidal size, flow rates, and margin of safety. So conclusion, 𝙂𝙬𝙚𝙪𝙡𝙀 embolization is the best way to treat the vascular malformation because it kills the nidal cells and it gives a permanent cure. Now, technique of ethanol injection is the key to success. One will learn this technique if your center has a good number of vascular malformation patients to treat. And believe me, this is very true that interventional radiology is an ideal person to treat vascular malformation because this treatment needs patience. It requires multiple sessions. Even though during the procedures I have to take between the first injection of ethanol and the second time injection of ethanol, between that I have to take a gap of 5 to 10 minutes, and you have to do nothing within 5 to 10 minutes, right? Because you already injected ethanol. Ethanol is working within the patient within the body of the patient. So just ideally sitting for 10 minutes for any interventional radiologists can do, but other surgeons or other vascular surgeons cannot do. So interventional radiologist is the ideal person to treat the vascular malformation. Thank you.